Hello viewers, this is a special edition from OBN Horn of Africa. With this program, I'll be holding discussion with Dr. Mohamed Elduma, Head of Health Unit with the IGAD Health and Social Development Division. Thank you, Doctor, for joining me.
Thank you for having me.
As we know that IGAD has been carrying out various activities just to capacitate the East African people, especially the member states in the IGAD region, and health is one of the aspects IGAD is working on. So what are the programs you are running concerning capacitating the medical treatment or health professionals or just giving responses to certain kinds of communicable diseases?
Yeah, thank you so much for having us today to discuss about what IGAD Health Unit doing in the IGAD region. And IGAD has a lot of effort to provide specific health services and promoting the well-being of the population in the region. And IGAD was given a mandate by Ministers of Health in 1989 through the Horn of Africa Initiative to focus on complementing the effort of the member state in availing access to the services, especially in the remote area, cross-border area, vulnerable population like refugees, other displaced population like IDPs, migrant, people who cross the border regularly and need to continue their service across the countries in the neighboring country. From those mandates of IGAD, accordingly IGAD try to design projects and programs to support member states to establish collaborative effort at the cross-border area. So most of our current projects, they are focusing on this. For example, we have tuberculosis and HIV for the refugees, and we have it for cross-border communities at the cross-border areas. We have regional, we have an effort to have a regional information sharing because we think that mobile population like pastoralists and others, they have diseases and they have children who can start vaccination on one side. They need to continue that vaccination or medicine on the other side. So we have a program on digital health where we try to improve the information sharing at the cross-border between the countries. And this will improve the continuity of the service. If you receive one vaccine on this site and the vaccine has 3 shots or doses, then next month if you cross to the other country, especially the pastoralists, because they move for grazing, so you can continue still your vaccination for your kids, or TB drugs or HIV drugs, you can continue in the other country. So we have that program. We have a maternal health program where we are trying to focus on issues related to women, children, adolescents, and youth, and we are trying to provide services for them. And also it's focusing on cross-border areas. Recently, we have support from the World Bank. We are in the process now to start a program on health emergency, where we try to help countries on preparedness and response to the health emergency. During COVID, we were also having a very generous support from the European Union. So we supported countries in responding to the COVID pandemic from 2020 until 2023, the project, with a lot of support to the cross-border area in terms of PPE, the personal protective equipment. We provided ambulances to 3 cross-border areas in each country. We provided mobile labs. We provided a lot of support, technical support, training, and all this for the countries. And we also built 2 facilities in South Sudan. We know South Sudan is a little bit vulnerable for quarantine and for the isolation, where we will support South Sudan to respond to any future emergency similar to COVID. So those are our efforts currently that we are working on. But we are working generally with the ministries of health of different member states and with different our partners like the African Union, the World Health Organization. So all those we are working together so that we can help our member state, the citizen of our member state, so that they can have health services.
As we know that health and sanitation are the major areas that need attention aligned with having healthy society. So what are the works being done by IGAD concerning health, sanitation and nutrition?
To raise a very important issue in the region. We know IGAD region is affected repeatedly by drought, and drought affects the season, the agriculture products and all this, and that will be reflected into the shortages in the nutrition, and addressing nutrition is a multi-sectoral first. In IGAD we have a division of agriculture where they have a unit agriculture and nutrition. In the health unit we also have a nutrition. We have a center of excellence for nutrition in Nairobi. We are trying to address the impact of those things. For example, as I said, drought, even climate-related issues, even sometimes floods have adverse effects, the same like drought, because even if you plant something and flood comes, it will spoil all the season. So there is a lot of challenges in this region, and we notice that there is a lot of humanitarian support coming through World Food Organization and others to fill the gap. But from us, from the health point of view, nutrition is very important, and especially in the first 1,000 days of the child, that is around 3 years, where the grow up and the maturity of the child, and also as you mentioned, stunting and other type of the malnutrition, they affect the children not only while they are child, also when they grow up, become adult, because it will affect the attainment in the education and other. So nutrition in the early childhood is a very important if we want to benefit from the human resource, the human capital that we have. And IGAD is trying to address this. We have the nutrition program. We have a steering committee from all nutrition directors from ministries of health, and we are constantly trying to address, and we coordinate also with our colleagues from the agriculture, so that we trying to fill the gaps, not only the macronutrition, but also micronutrient, which is very important to fill the gap. So nutrition is one of the priority in this region, especially in the IGAD region.
The IGAD region is known for hosting large number of refugees. Almost about close to 5 million refugees are just there in the IGAD region. And IGAD has got really a huge reputation, even including in the last refugee summit held in Switzerland, Geneva. What were the works you did just for getting such recognition for your activities on refugees?
Thank you so much for bringing this very important. As I mentioned in the beginning, not only health program, all IGAD programs are focusing on the vulnerable population because, as I mentioned, we are complementing the member state effort. So the countries, they focus on overall citizen, but we are trying to address the gap like refugees, migrants, and pastoralists because they are moving. So IGAD effort in refugees, especially in the health, starts very early. Actually, since 2007, 2008, we have a big HIV program at that time for almost 8 years until 2016, where we were addressing the issues related to HIV at that time for the refugee. But recently, with the global movement to address the refugee in 2016, where New York Declaration and 2017, IGAD, also head of state, come together and have a Nairobi Declaration. IGAD now moving to have a durable solution for the plight of the refugee in the region. Actually, 1 million only in Ethiopia. In IGAD region, we have 5 million refugees. In Uganda, Kenya, Ethiopia, Sudan, and South Sudan, and even Djibouti, even Somalia, all they have numbers, considerable number of refugees. And in this, also we are trying to address the returnees, people who return, like Somalis who return to Somalia, or South Sudanese who return to South Sudan. So this number is big. So we come together as IGAD. We are trying to address and to find a durable solution. Durable solution in the definition of the UN Agency for Refugee, that to have resettlement or return or local integration. 3 of them, they are not possible. So IGAD come together and we thought, we know those are not possible. Let us have solution for those population where they are. So we think about self-reliance, we think about to have a dignity, work and others. And you mentioned Kampala Declaration for jobs and livelihood, so that people work and produce and don't depend on international community. We have, by the way, Mombasa Declaration on health for refugee, where we are spearheading that agenda in the health unit. So those are all efforts so that we integrate those refugees, not in terms of naturalization, but in terms of services. So we have to have, in the health service, we don't have parallel system. In education service, we don't have parallel system. The current or the youth system, they have it, schools for refugee and school for host community. You have health facility for refugee and health. Now we are going for inclusion. We include both of them in one school or one health facility. So where the same service that provided for the citizen are provided for them. So this is now the way to go, and this also improve the coexisting together. We used to have a lot of friction and conflict between the host community and the refugees. Now we are moving towards, they are collaborating, they are working together. We have now committees together where refugees and host communities sit together. So that is the effort that we reflected in Geneva, as you mentioned, in the Global Refugee Forum. And we are spearheading all the agenda related to refugee, and we will continue that. And we are trying to address all the services. Health is one, education is one, but the most important, to give them self-reliance so that they have income, they are not idle, they produce, they are economically active, they contribute to their hosting now, and later on, if they return, they also contribute to their countries.
Earlier, you've mentioned about the issue of capacity building among the IGAD member states. So, just in doing so, readiness is a main thing that needs attention, any communicable disease. So far, based on your engagement, how do you evaluate the potential of the countries in the IGAD member state concerning the readiness to respond pandemics or any communicable diseases as fast as possible?
Thank you so much. This is a very important issue, Paris. The pandemic now is increasing. Actually, interestingly, in our region, we think that epidemics are endemics in this. Those are medical terminology, but I mean the outbreaks in our region is continually coming every year. We have cholera every year. We have yellow fever every year. It became epidemic. So our effort in IGAD to try to help those countries, as you mentioned, to build the capacity to prepare for those outbreaks and epidemics and to respond timely. For us as IGAD, each country, they can build their national, but we help them. But the most important, to help them all together to protect the people in the region. For example, cholera in cross-border between Ethiopia now, in Moyale, for example, and Moyale, Kenya, is very easy to spread, and Somalia, 3 countries, and the same maybe with Sudan and South Sudan. So try to protect and prevent the spread of those epidemic across the border. Try to use the acids that we have in those cross-border area in the countries. For example, screening for COVID. It used to be maybe in some countries, this gene sequencing and all this. We can help in transferring samples from one country to another country. So those collaboration within the region to help in diagnosing the outbreak early, to prepare even before and to respond after that. This is what we are trying now. And even furthermore, we are trying to build the capacity with the support of even international community in vaccine manufacturing, so that we also be ready if there is any epidemic like or pandemic like COVID, so we can be ready to protect the people and have the means. And everybody knows during COVID, it was very difficult to Africa or our region to access vaccine. So we are trying to domesticate those, and hopefully and there is a movement in Africa for local manufacturing, and we are in IGAD also. We are pushing the countries so that we are be ready with the support from African Union, Africa CDC, and other international organizations, the finance international organization also. They are very supportive. So this all effort at IGAD, so that countries try to be prepared for any upcoming epidemics or pandemics.
My last question is going to be about very complicated diseases for which the IGAD member states cannot get medical treatment or health service within their country. Maybe as IGAD, if you take, for example, the case of Ethiopia, for very chronic and complicated medical situations, they are referred to abroad to get medical just treatment or health service. For one thing, the majority of the people are poor, their economy cannot afford that. As IGAD, I think this issue maybe can be shared among the IGAD member states because their livelihood is very much similar. So to solve this problem, IGAD as a regional body, is there any arrangement or any plan maybe to establish a very giant hospital for which people can get any kind of treatment they deserve, maybe with very low price, or maybe in any way, just they can afford it.
Thank you so much. First, to bring this issue, we call it non-communicable disease. I know we still have a problem in communicable disease like malaria, HIV, TB, but non-communicable disease now they are the major killer for our population in this region. Actually, 40 to 60% of the deaths in this region, it is from the non-communicable disease. Here we mention cancer, heart disease, respiratory disease, and maybe diabetes, and all those communicable disease. And really, still the capacity in all our member states is low to treat those drugs, and also they are very costly. They are very expensive to treat them. So all the element of unavailability of the service, the countries that don't have the ability, financial ability to establish big centers and all this. So this make a lot of burden on the population in this region. And people who move abroad to get the service, they are very few, because most of the people in our region also they are very poor. They cannot afford. And I can tell you, many they are not able to afford to go outside or even in the country, because those diseases, we call them, they make catastrophic effects. They impoverish people. If you are very rich and you have cancer, within 1 year or less you become poor, because they will actually use all your resources and saving. So we try in IGAD we thought about this early in 2012, 2014, and we have many consultation with our diaspora in the North America, especially Canada and US. And we have an idea, for example, to have cancer centers in all member states, a regional one in Addis and a specialized one in each country. You know, cancer like or head could be in one, in abdomen in one country, breast cancer in one. So, but all those efforts still not have seen the light or whatever, because still they need a lot of resources. You need radiology, you need chemotherapy, you know the spectrum of the cancer. And similarly for also other non-communicable disease. But the most important that us and IGAD, and this is our priority, by the way, for the next 5 years, first to focus on prevention, on awareness for our people, in early detection. All those things are not expensive. We can do it while our economies can be better, so that we can provide this service now in our region. So diabetes and high blood pressure and some of the heart diseases, with awareness you can, with early detection, even you can prevent a lot of complication. So this is for us in IGAD region, it is a priority number one, because it is actually killing most of our people. So we have to put it high in the list. Like nutrition we discussed, maybe is a second in the list, because still nutrition has effect but not killing immediately. Other diseases might be in the bottom of the list. But I think this is a very valid point, and I assure you in IGAD Health we are going towards that, so that we can help the countries. Actually, by saving 40% of the people, you are boosting 40% of economy, because most of those people, they are young people also, and they are able to work. and contribute to the economy.
Thank you, Doctor, for your brief explanation and also for your precious time to respond to my questions. That's going to be the end of this special edition, and stay watching the remaining session of OBN Horn of Africa.